All right, so you just had your fat grafting procedure with us, so I'm going to go over some of those post-op care instructions with you. So we would have sent you home with a care package. In there, you're going to have some ice packs, some gauze, some Arna care, as well as some Aquaphor ointment. So throughout these instructions, I'll go over how you can use these things. So after surgery, you may have some bruising, some swelling. This is very normal and to be expected, both at the donor site and at the transfer site of the fat grafting. So where we take the fat from, you may have a small incision. There may be some steri strips on there. Those will stay on for 5 to 7 days. If they come off beforehand, that's okay. Just make sure to keep the area clean and dry. You can apply the Aquaphor ointment there twice a day, and then you can cover it with a Band-Aid or leave it open to air. For the Arna care, so at your donor site as well, where we got the fat from, there may be some bruising. This is where you can apply the Arna care gel there to help with the bruising. And very normal for this area to have some swelling and to be tender as well for the first week or two after the procedure. As well, from this site, you may notice like a pinkish clear drainage a little bit. This is also normal. To be concerned of would be if it's foul smelling, greenish in color, or if it's like a pus consistency. So anything like that, please just make sure you reach out to us and let us know. For your swelling, so your swelling is probably going to peak around 24 to 36 hours after your procedure. To help with the swelling and the bruising, you can apply the ice packs that we give you in your post-op care. So with the ice packs, just make sure you're wrapping them in a cloth or a piece of paper towel to make sure the ice isn't directly on your skin. And icing for 15 minutes at a time and then taking 30 minutes break. And you can do this throughout the first 1 to 3 days after your procedure as needed. So to help with any swelling, you can sleep elevated with 1 to 2 pillows, whatever you need to kind of get that 30 to 45 degree angle incline. And we suggest to do this for the first week or so just to help with that swelling as well. 24 hours after your procedure, you can take a shower. Just make sure your shower is lukewarm. It's not steaming hot, as the steaming hot temperature will increase your swelling. Making sure to keep your little incision out of the water as best as possible, and keeping that incision out of water for 4 weeks after your procedure or until it has closed. So no swimming, no soaking in a bath, and no saunas until that area with the incision has completely healed. Activity-wise, we ask that you stay away from strenuous activity for a minimum 7 to 10 days after your procedure, or as directed by one of our providers here, whether that may be a longer period of time depending on your healing process. So things to note of, as I had mentioned before, any foul smelling drainage, pus drainage. If you notice you have a fever, increased redness or swelling around any incision sites, please just make sure to notify us so we can take care of that. So during regular hours, you can contact our front desk. Anything in the evenings, on the weekends, you can reach out to the provider that would have given you their contact information for these after hours. As well as after your procedure, if you happen to go to the hospital for any sort of emergency not related to your procedure with us within those first 10 days, please just make sure when you have a chance you call our clinic and let us know, just so we're up to date on your health and if there's anything that we can do on our end as well. From your donor site, like I said, you're going to have that small little incision line. To keep it clean, just pat dry, apply the Aquaphor ointment. You can put a Band-Aid over top of it if you would like, or you can leave it open to air while it's healing. If you're having any pain or discomfort, you may take any prescribed pain medications we gave you, as well as anything like Tylenol or Tylenol Extra Strength is great as well. We just ask that you avoid any non-steroidal anti-inflammatory drugs like Advil and naproxen for the first 5 days after your procedure, as these are going to increase your risk of bruising and bleeding. So for a follow-up, you're going to have a follow-up 7 days after your procedure. We'll take a look at your donor site and the site where we transferred the fat to and make sure everything is healing well and looks good. From there, depending on how everything goes, we'll schedule further follow-ups as needed. But if you have any questions from after these appointments and anything in between, you can always contact us. But otherwise, happy healing. Thanks for choosing us at Visage.